So I've been doing palliative care clinically, although I don't practice right now. But I started, 25 years ago. I had been an intensive care nurse as well as an oncology nurse, and recognizing that in the arenas in which I was practicing, I was not able to address these end-of-life needs or these palliative care needs. And so I went back to graduate school. I got a part-time job as a hospice nurse during graduate school. And so, I wanted to address these issues. Somewhere along the line, when I started doing research in earnest, for some reason, and I can't quite tell you why, I was drawn to working with staff and residents of nursing homes. That was actually one of my first jobs in high school. I was a nursing assistant. And recognizing that about 25% of older adults who die in this country do so in a nursing home. And I think we don't want to think about that, or it's hard for people to believe. But it's an important arena for end-of-life care, and yet models of care outside of having hospice involved in the care of people who are living in nursing homes, the models really aren't well developed. And so my research is always focused on palliative care models, pain assessment and management models of care for people who are living in nursing homes. And some of my projects focus on patients or residents who have advanced dementia. And when we talk about palliative care, and that's not the same as end-of-life care. Palliative care is care for people who have a serious illness. Palliative care for that group of people may include discussing goals of care, symptom management, addressing a broad spectrum of issues for anyone who has serious illness. That care may occur way upstream, years and years. And in fact, we in palliative care could take care of people who won't die of their illness, but are certainly at risk of having a shortened life. But end-of-life care has grown increasingly important. So in terms of the future, there is now a groundswell of support, and I think we're at an important juncture with regard to infusing palliative care into the care of people with advanced dementia or the care of nursing home residents. I have a project that's funded through the Department of Veterans Affairs, in which we are developing we're working with families and staff to form partnerships around the care of people with advanced dementia. Very often, unfortunately, families and staff in nursing home are at odds. And I think that there's a variety of factors that contribute to that. Some of it is the poor staffing levels that we have in nursing homes. Staff are stretched thin. We have families who, quite frankly, feel very guilty about having to admit their father, their mother, their loved one to a nursing home. And I think that guilt at times gets projected onto staff with really high expectations, with a lot of angst and anger. But anyway, so we're forming these partnerships, and that project has been funded along with colleagues of mine in Ann Arbor and Rochester, New York. And we will be implementing this program in VA nursing homes and looking at the outcomes. I would also like to take that model after we test it in the VA and test it in community nursing homes. I'm also working with a group at Indiana University on a project that's funded through the Centers for Medicare and Medicaid Innovation, to look at a model that incorporates palliative care as well as other approaches to care in a way that will reduce hospital admissions for people, for nursing home residents. We know that these admissions to hospitals for frail elders who are living in nursing homes are fraught with problems. I mean, not only are they expensive, but more importantly, when a person is, who, let's say, has dementia, is taken out of their familiar environment, put in the chaotic environment of a hospital, they're at risk for higher rates of delirium. They're at risk for all sorts of problems with medication because the communication between the nursing home and the hospital is poor. Lots and lots of problems. But anyway, so this project is the initial project is in its final year, but we've been approached by the Hartford Foundation as well as CMMI, who wants to continue these demonstration projects. So there's lots of really exciting opportunities.